Namaste. My name is Revati Kandukuri. I'm a psychologist at Sudisha Counseling Center. And today I have psychologist Dr. Geeta Chella madam with me today. Namaste, madam.
Namaste.
Ma'am, as we all know, we got Union Budget 2022, and there is a mention about mental health awareness program in that. Madam Finance Minister Sitharaman, madam, she explained about 23 centers, telecounseling centers, which they are going to set up very soon, launch to help everybody, people from all age groups. So if you can give me a minute, I'll just read out the news for you, ma'am. And later on, I would like to know your feelings and reflections about this news.
Definitely. We are looking forward. We are also feeling very happy to listen to the news and let all the viewers listen to the big news.
Okay. Thank you, ma'am. So looking at the increased need for mental health awareness due to pandemic and for easy access to quality mental health services, Finance Minister Sitharaman has announced a plan in Union Budget 2022 to set up 23 tele mental health centers, which will be launched with National Institute of Mental Health and Neurosciences as the nodal center. The Indian Institute of Technology, IIT Bangalore, will provide technical support for the mental health program. So, ma'am, this is the news, ma'am. And I know you are like in this mental health awareness field for last 25 years, well experienced psychologist, I would say. So, ma'am, what are your reflections regarding this service, ma'am?
This is a very big news and good news for the entire nation, because mental health has been always neglected and nowhere mentioned. It is always behind the screen, and there is a lot of taboo and a lot of stigma attached to this. But so big, Nirmala Sitharaman, the finance ministers, in the budget, when this come, it become a very big news, and it is a very good news also. I welcome from Mano Jagriti, and on behalf of all this community of psychologists, we are welcoming it. We are very happy for that.
And ma'am, now I would like to say some research, based on some research, it is found out that only 14% of population in India, 14%, they are undergoing somewhat other kind of mental health illness. And only 7 out of 100%, only 15 to 20% of budget is allocated for mental health. When it comes to all the healthcare, for mental health, it is only 15% which they are allocating. So on this, what are your views, ma'am? You are in this industry for some time. What kind of work you do? How do you help so many people to come out of different mental health issues? So would you like to say something about it, ma'am?
Yes, very briefly. Generally, mental health, again, I would reiterate that mental health has been always neglected, and people do not give that importance to that. This service is required. So the budget allocation also is actually completely neglected. They don't allot anything to this specifically. But being into this field since 25 years, I would, I would suggest and also welcome if every school, if education department can have something to do with mental health, if welfare department, women and child welfare, can do something for specifically for mental health, and if other departments, like in police also, they need something, the police also will be under stress. So each department, it's not one, so each department can have a separate wing, separate activity, separate budget for mental health. Because if a person is mentally healthy, productivity will increase or the performance will increase. So it will add value to the work, value to the nation. So it is very important, and let us welcome it again.
Very nice, ma'am. And people are saying after pandemic, but what I feel is even before pandemic, since so long, mental health is very important, and awareness is very important. And with this move, I believe that these services will be easily accessible to millions of people. And by prioritizing mental health, Finance Minister, she has really taken an important step, which is, in fact, I feel that need of the hour, ma'am. And I would say this as telemedicine, which will be affordable, and we can move towards the goal of mental health for all. Thank you so much, ma'am.
Thank you so much. And we look forward for more initiatives from state and central government for all the community of psychologists and mental health field. This is a good move and looking forward for more. Thank you so much.
Thank you, ma'am.